You're listening to the Public Health Perspectives podcast. Welcome to another episode of Public Health Perspectives, a podcast series targeted towards strengthening the future public health workforce. We will explore the narratives of public health care professionals and gain insight on career paths that shape the profession. And now, your host, Camilla Singletary.
Welcome to another episode of Public Health Perspectives. Today I have Marcus Stanley on the show with me. Mr. Stanley's work focuses on capacity building for efforts in order to create sustainable systems for HIV care and awareness. Welcome, Mr. Stanley.
Thank you for having me.
Can you tell me a little bit about you and your educational background?
Sure. I have a little over 15 years of experience in public health. I began my public health career at my undergrad alma mater, which was at Georgia Southern University, where I obtained my bachelor's degree in child and family development. And currently, I am finishing my master's in public health at Emory University, Rollins School of Public Health, and I will be finishing that in June of this year. I am currently in thesis mode.
As far as getting involved in public health, what made you want to focus on HIV awareness?
So during my career at my undergrad at Georgia Southern, I was working at the health services on campus, and I was in charge of campus-wide educational programmatic activities around the time when the health services were getting their first grant to do HIV testing on campus. And when they were pursued this grant, it was written for only graduate students to conduct this testing, and which I was an undergrad student, but they actually entrusted me as their first undergraduate student to actually go through the training and conduct the HIV testing for the health services on campus, and that's how I originally started. And I fostered a love and a passion for the work, and I've been doing that ever since.
With your current job, can you talk a little bit about what you do?
So currently I work for the University of Houston in their Graduate College of Social Work, and I'm working on a project called the Gilead COMPASS Initiative, where we're working with southern states, particularly the 9 Deep South states, to build up the capacity of those states to actually address the HIV epidemic a little bit better in the South, because as we know, that's where the epidemic is hardest hit is South. So my role at the University of Houston, we have our focus areas of overall wellness or well-being, as well as trauma-informed care, substance use, particularly the opioid epidemic, to include harm reduction strategies, as well as mental health services and telehealth in any of those previously mentioned content areas. So I currently work at the University of Houston in their Graduate College of Social Work, where I am the project officer for the Gilead COMPASS Initiative. And in my role, I'm charged with working with organizations across the South to help build the capacity to address HIV, particularly in our content areas around overall wellness and well-being, mental health, as well as trauma-informed care, substance use, particularly the opioid epidemic, and focusing particularly on harm reduction strategies, as well as telehealth in any of those previously mentioned content areas. I've directly funded 11 organizations that I'll be working with across those 9 Deep South states over the course of the next year to build the capacity in the proposals that they have submitted. So that's what I'm doing currently now in my work. Yeah, and it's also important that I mentioned that the University of Houston is only one of what is called coordinating centers who have actually distributed these, what is called transformative grants throughout the South. There are 2 other organizations, one being the Emory Rollins School of Public Health, and their content areas are focusing particularly in organizational sustainability, particularly those topics around keeping the lights on, so like governance, board development, and then our third coordinating center is the Southern AIDS Coalition, which is located in Birmingham, Alabama, and they're particularly focused on anti-stigma campaigns and advocacy as well as it relates to HIV. So it was important for me to mention that as well, that the University of Houston is just one part of the coordinating centers, and the coordinating centers is just one part of this COMPASS initiative.
What's the general response to those that you guys are trying to help?
So what's interesting about this project is this project has been built from the ground up. This is only the first year of this project. However, when building this project, we've done community engagement, particularly a lot of what is called listen-in sessions, where we visited a lot of organizations, like on the ground, and met face-to-face with a lot of organizations, as well as a lot of stakeholders around those Deep South states, and met with some health departments, local and state, to kind of get a picture of how communities view their communities, because we understand that, we are in a position where we will be actually working with these communities, and we understand that we cannot build anything for them without them. So one of the important things that I've learned about working with this is that community engagement is very important. So with that being said, the response has been, in all transparency, the response has been one of a bit of hesitation, because it's something, like I said, that is being built from the ground up. But what the silver lining in this is that, even though there's a little bit of hesitation, they see and understand that it's something that is different and it's something that is needed. So they are open to being transparent, open, and learning, and actually having a partnership type relationship with the initiative and the community, so that we can actually foster something for change. I can tell, like, for instance, I can tell you what may be best for you, in my opinion. However, if you don't feel that that's best for you, then what I'm telling you is a moot point. So what I like to do is I don't come into community, because I don't consider myself an expert, because I'm coming in someone else's community and I consider them the expert in the community. I'm coming there to learn. So I think that's an aspect that is kind of missing, that even though you may have like this subject matter expertise, you are not an expert in this lived community.
Exactly.
And that's an important concept to remember when working with community, particularly communities that have been traditionally vulnerable and traditionally overlooked.
What are some of the roadblocks that you've experienced?
Three come into mind. One roadblock would be the roadblock of tokenism, particularly with the work that I am doing. The focus population, or the priority population, has always been, what has traditionally been or usually been, Black men who have sex with men. I myself am a Black man who have sex with men. So therefore, a lot of organizations would like to hire Black men who have sex with men, just to say that they have Black men who have sex with men on staff, and not utilize them to their full potential. So that's one roadblock that I have experienced in my career. Another one has been my own self-doubt, and particularly around how individuals living with HIV perceive me, working in this field and not living with HIV. But what I had to actually realize is that, that is a thought that is kind of detrimental to the work that I am doing, because essentially what I am saying is only individuals living with HIV should care and work for individuals living with HIV, which is a totally false statement. So that was another roadblock that I had to overcome. And lastly, it was a roadblock of burnout, and then also identifying vicarious trauma, and understanding that, I'm dealing with individuals who potentially may have lived through some horrific traumas, and that, I myself may take on some emotional residue as a result of that exposure, and that I also have to take care of myself. And, that is one piece of advice that I would give someone that is coming to pursue a similar career like mine, is that to take care of yourself within taking care of others.
How do you kind of measure your performance and your success, keeping yourself kind of above ground when I know you said sometimes you're dealing with that self-doubt?
I measure success by the involvement of the individuals with which I'm working for. If I look around and I can see that there has been meaningful involvement in every level of decision-making from the community in which I'm working with, that's what I consider success. How I hold myself accountable is through a few values, which is some of the shared values of our COMPASS Initiative. One is always having meaningful involvement of people living with and disproportionately at risk for HIV. The second one is always looking at everything through the lens of intersectionality. It's particularly around social and racial justice, because I understand that racism, both interpersonal and structural forms, they actually limit and control how services and resources are allocated. Lastly, I always, in all my communications and all my dealings, try to be open, transparent, and learn something, and also be committed to what I'm doing and have it be a collaborative process.
We talked about being the expert. And, we have to realize, like, everybody is a lifelong learner, and there's always something brand new that you can learn about somebody.
And I always say that if I'm not learning, I'm missing an opportunity. One of the things that I've realized is that I've been working and doing this for 15 years for communities in which I live and eat, sleep, and play. But, I've never had these conversations, with my own family. And that's something that I've been started to remedy within the last couple of years. So every time I go home, we have some sort of discussion where we're talking about something public health related, or they're asking me some sort of questions that, they have around HIV or around sexual health, because I think it's very important that I take that back to my family as well. Because in all these years of me doing that, I just never realized, it never just dawned on me that I have to do this, for my family as well.
Great. This concludes another episode of Public Health Perspectives. I would like to thank Mr. Stanley for joining us to share details about his work with the Gilead COMPASS Initiative and his journey related to HIV and AIDS capacity building. As always, you can tune into this podcast and others by visiting jphmpdirect.com. We're excited to announce that the Journal of Public Health Management and Practice is celebrating 25 years of bridging the gap between research and practice. Our most current issue is available on our site at journals.lww.com/JPHMP. In addition, we also have our January-February supplement available on lead poisoning prevention. Stay tuned for a new podcast featuring editor Dr. Lloyd Novick as he talks with Dr. Tim Dignam from the CDC about the history of efforts in the United States to prevent lead poisoning, especially among children. Follow us on Facebook, Twitter, Instagram, and YouTube, and please let us know if there is any way that we can be better at providing relevant health information to you, the public.